is very vital because kids are the future leaders of tomorrow.
Members of Club 4 also left for the SOS Children's Village for a similar donation. Famra Fofana, Grts.
Celebrations marking the beginning of a new year are in progress. Banjulians and people from the Combos Tuesday morning descended on Lovell Square for grand annual hunting carnival. As we hear in this report by Babukar Senghor, the street party is with the intent to promote cultural diversity in the country.
One of the first month of a new year and the long-held traditions and norms of this old city of Banjul, despite changing times, is still being nurtured by the people of this city. It is a heritage imitated by their grandparents from their ancestral home of Sierra Leone. Hunting has been in existence in the Gambia for a century now, with Banjul being its historical place of origin and Liman Street the first to accommodate this colorful celebration. An event happening every new year, drawing the attention of scores of onlookers from within the greater Banjul area, is purely geared towards preserving the black culture and promoting tourism.
Coming together as one and also safeguarding our culture, which has been passed down generations onto generations.
Albeit the presence of other cultures in the country, hunting is a kind of culture that depicts an extraordinary style reminiscing the customs liberated ancestors have had, as the masquerade reserves a deep-rooted spiritual undertones which is untouchable.
Now, these people, having been carried away, now to see that they don't lose their culture completely, they sort of reminisce reminisce of their past in Nigeria, because this cultural society is more of Yoruba, because I mean there is a lot of Yoruba inclination.
With Banjul widely known for hosting this annual Grand Carnival, its two biggest heads taking part in this traditional practice in the country are Ekun Babab Ode, formerly Dokomoro Hunting Society of Lovell Street, and Odele Hunting Society of Long Street in Banjul.
What they are doing the same thing just like us, but everything in every year you have to do improvement. There's always improvement. So people come in to see what is the improvement that Ekubama will give to the public, and then from here now they go to Odele's ground, and then they want to see the improvement that Odele has done last year for this year. So that's the time people make comparison. They start to say, well, this is the best, this is the best.
I advise them, let's make peace and move together. When we meet together, we embrace each other.
These two big rivals who live not far from each other have been on the scene for 4 decades now, but have a stiff record of rivalry between them as they compete to gain superiority in the hunting folk of Banjul, as they pumped in colossal amount of money in the promotion of the masquerade in order to showcase different talents they have.
Come in the evening and see the different types of animal masquerade that is coming out, then you know. Because these things we get from South Africa, from the Americas, from Europe, from Asia. It's not easy. It's becoming very expensive.
With hunting believed to be a Yoruba culture, stolen from Africans by South Americans due to slavery, other stories reveal its reemergence in Africa, particularly in Sierra Leone, then to the Gambia through liberated slaves. For Grts News, this is Babukar Senghor.
The Minister of Health and Social Welfare, Honorable Balagaba Jahumpa, accompanied by a high-powered delegation, recently began the second leg of his tour to public health facilities within rural Gambia. Babukar Kamara reports the exercise seeks to acquaint Minister Jahumpa with existing realities on the ground for improved provision of primary health care services to Gambians.
He was given a hero's welcome for his actions have traveled far and wide, despite his years of absence due to earlier redeployment in the foreign service. He is known as Action Man not by virtue of his personality and loyalty to President Jammeh, but his ardent concern to the development of the Smiling Coast as a true patriot working round the clock.
Some of these issues are basic necessities for the health center. It should not wait for the ministry or for the president. Really, it's at the management level of these health centers and for the hospitals, because we feel that the Ministry of Health and Social Welfare is not an office work, it's a field work, and most of it needs action, action, action.
He have earlier renewed his allegiance to the Gambian leader and embarked on the second leg of his nationwide tour, engaging 13 health facilities covering the 118,000 population of the North Bank region, sparsely inhabited within 163 villages. He started from Esau to Medina Serigne, where a community clinic on the rehabilitation is predominantly financed by their homeborn Dr. Njoguba. He worked round the clock and retired after a painstaking exercise lasting for 22 hours, visiting Kerkerno, Kuntea and the AFPRC General Hospital in Farafenye, reaffirming gains underscored by the Jammeh administration.
Some of the health centers we visited, I noticed that, where the patients are on the beds, there are no pillows. Some of them were even trying to struggle to take their bags and use it as pillows. So I felt that these are basic necessities of any health center that they should provide to our people. And hence directives were given on the spot to get some pillows. And as we go, as you can see, we bought a lot of pillows, and as we go, the same thing in many health centers, we distribute them. What I have also observed in these health centers, apart from pillows, is that you have family and friends who come into the health centers to visit their patients, and they don't have anywhere to sit. Instead, they sit on the beds. That is also not acceptable.
We have, seen what he has done, and I have no doubt, because he's called an action man. Immediately on the spot, he was able to solve most of our problems. One, we need refurbishment of the hospital. The hospital since 1999 has not been refurbished. He promised that GAMWorks would be here as soon as possible, I think next week, to assess all the refurbishment requirements of the hospital.
His findings on the high incidence of malaria cases were not surprising for a man who values the opinion of every individual and looks beyond the capacity of an ordinary eye. He sounded their opinion as auxiliary staff, patient and community leaders, with a view of incorporating their concern in his new cabinet portfolio as health minister. His talk continues. Babakar Kamara, GRTS.
The Network on Gender-Based Violence over the weekend ended a two-day sensitization on gender and HIV/AIDS at the National Nutrition Agency. Fatmata Simaha reports on the program, which brought together stakeholders to discuss gender and HIV and AIDS with emphasis on its eradication.
On gender-based violence is a Finnish initiative aimed at combating violence against women and girls in the Gambia. It is also a platform which seeks to bring together NGOs and public institutions involved in women empowerment, as well as provide coordination and discussion of gender issues in the country. The Deputy Director, Social Welfare, Falu Sow, reiterated that gender-based violence is a serious issue which needs collaboration and partnership. He called for better coordination and communications between stakeholders and service providers to ensure that gender-based violence is eradicated. The Director, National AIDS Secretariat, NAS, Usman Baji, described gender-based violence as a serious public health and human rights problems such as HIV and AIDS, domestic violence of women and girls, and several harmful traditional practices which reflects and reinforce inequalities.
Health policies and programs often focus on the biological aspects of treatment, prevention, and diagnosis of HIV and AIDS. So now the world has come to realize that besides the biological aspect of diagnosis, treatment, and prevention, there is another very important dimension to HIV and AIDS, and that is the social factors, of course, including gender-related issues.
The country officer, UNAIDS, Mr. Noah Cisse, who highlighted the crucial role his institution plays in the fight against gender-based violence, also gave an overview of research on harmful reproductive and sexual health practices women encounter in some instances, resulting in untimely deaths.
As for young women, research conducted in many parts of the world concluded that young women may be particularly more vulnerable to HIV infection for a variety of reasons. Among them are the fact that young women have immature cervix with a thinner mucous membrane which secretes lesser amounts of protectants against viral penetration.
Noah revealed that the gap remains very big in gender equalities and various types of gender-based violence and HIV